and therefore that results in clinical dengue. Then there is dengue hemorrhagic fever, that is, the dengue infection is so severe that apart from the other clinical features, the person can get bleeding also because of low platelet count. So the bleeding can be under the skin, that is patches, red patches or blackish patch. It can also be in the form of nasal bleeding called epistaxis, or hemoptysis, bleeding in the cuff, or bleeding in vomiting, that is hematemesis, or bleeding in the urine or stools. So because of the low platelets, the person can get bleeding, and that results in dengue hemorrhagic fever. And the last spectrum, which is the most dreaded, is what is called DSS, or dengue shock syndrome, wherein apart from the other features, the person gets severely dehydrated, the blood pressure drops, and because of the blood pressure drop, bleeding tendency, there is renal shutdown can take place, resulting in acute renal failure, and this can result in lot of morbidity and sometimes mortality also. So dengue fever by this mechanism can lead to death of the patient also, and that's why it is very important to understand and detect and treat it as early as possible. So what are the lab tests that we do? Immediately as you get a fever, within the first 3 days, one test called dengue NS1 becomes positive, that is the antigen test. Apart from this dengue NS1, we also get a complete blood count which tells us the WBC count and the platelet count. And the hemoglobin is not affected in dengue, and therefore a difference between malarial fever and dengue fever is that in malaria the hemoglobin goes down, whereas in dengue it remains the same or maybe even higher. Because of dehydration, the hemoglobin concentration increases, RBC concentration, and you might get a higher hemoglobin and a high packed cell volume, a PCV. The WBC count can become normal or low in dengue, and the platelet count will become low in dengue, and as the fever progresses, the platelet count keeps going down, and it may reach as low as 3,000, 5,000 or 10,000, during which time the risk of spontaneous bleeding become very high, and the therapy involves transfusion of platelet concentrate. And in routine other tests that is done in a dengue fever is routine tests, electrolytes, the renal profile, liver profile which is deranged because of infection. However, encephalitis or brain involvement is very rare. So how do we treat dengue? Dengue is treated mainly by supportive treatment because there is no antiviral drug available for dengue. And the supportive treatment involves adequate bed rest, soft diet, lot of oral liquids to prevent dehydration, and that hemo concentration. To counter it, you need lot of fluids. Sometimes you have to admit the patient, especially if the fever is very high and persistent, the platelet count is dropping or the BP has started dropping, or if there is bleeding. These are some of the indications where we admit a dengue patient and we give IV fluids to the patient. We also, if the platelet count is very low and especially if there is bleeding, we give platelet transfusion. We have to do a close monitoring and daily a blood count to check the platelet count, and also closely monitoring the urine output and the intake status and the hydration status of the patient. Also, finally, the dengue prevention is similar to malarial prevention, that is prevention of mosquitoes breeding, and therefore locally, individually what you can do is use mosquito repellent creams, especially even during daytimes, because it can bite at your feet when you are sitting in your office desk or in the school. And it can also in the house, you have to see that the AC vents, there is no water accumulation, there is no water accumulated below your refrigerators, and in the society surroundings should be kept clean. There should be no stagnant water, all the ditches should be filled, the gutters should be sprayed with anti-malarial agents, and in general clean surroundings and adequate and prompt treatment is what is required for dengue. Thank you very much.